fine. Good morning, everyone. We're going to get started now. This presentation is actually a combined panel on marijuana-related topics. We have a guest moderator, Dr. James Lange from San Diego State University. We also have Mufaro Zakers and Cash Monet Hamilton from San Jose State University, as well as Lily Ernest, Blanca Pentek, and Shauna Dayon from UC San Diego. So let's give our panel members a round of applause. I believe UC San Diego is going to begin with their presentation.
I'm Shauna, wow, and I assist with our alcohol, tobacco, and other drug peers at UC San Diego, and we're here to give a little bit of an overview of our marijuana outreach. I'm here with my peers Blanca and Lily, and go through the next. So just a little bit of an evolution of our outreach. In 2010, we realized we were getting kind of a bit more requests regarding the information on marijuana, and one of the ways we thought about approaching the issue would be using peer-reviewed journals based on fact or fiction and the research that's out there. So we felt that it was a little bit too lecture-based initially, so we went from fact or fiction to a more kind of group Team A versus Team B format. So with the fact or fiction, we just had initially students raise their hands, you know, what do you think is the most commonly used illegal drug in the United States? And they would say, you know, do you think it's marijuana? And they would raise their hand. And then we evolved to kind of having two teams and giving the students multiple choice options. And to move away from the lecture base, we also kind of included an icebreaker, which Blanca and Lily will go through. Because this is a topic that's a little bit different than alcohol, because alcohol has standard drink amounts and it's a specific modality, whereas marijuana has different modalities. So I'm actually going to show you what it used to look like. So this is just an example of, initially it would just say marijuana is the most commonly used illegal drug in the United States. Do you think that's fact or fiction? And then this would be the slide that would follow. It would be fact. It included a graph, and it was kind of a little bit more science-y. And I'm going to actually have Blanca and Lily go through our most updated outreach, and you can kind of see how it's evolved in that sense.
Hi, I'm Blanca.
I'm Lily.
And we're student health advocates at UC San Diego. Basically, we're peer-trained health educators, and we go around the campus and educate students about all kinds of health topics, anything from sexual health, nutrition, stress, and alcohol and other drugs, which is what we will be presenting today. And so we've really tried to compile the information in this outreach from the most recent research that we found. One of the difficulties is that there's actually not that much research out there yet. We don't provide any of the sources on the slides, but if you do have any questions about where the information came from, we can provide that for you afterward.
And so what we do before we start any of our outreaches is we lay down some ground rules in the acronym REACH, where R stands for respect, E stands for encourage participation, A stands for allow for mistakes, C is for confidentiality, and H is for have fun. And then what we do is we break the audience into two teams, but for the sake of this presentation, since you're all over the room, we're just going to throw out the questions to all of you, and if you want to volunteer, you can raise your hand and answer one of the questions. We really want this to be interactive, so don't be shy. And what we named our outreach is the Great Triton Challenge, because we're the Tritons at UCSD. And then how we begin is we open it up to the audience and ask, what are some things that you've heard about marijuana? It can be anything. What do you usually associate with marijuana? Anybody? Volunteers? Just shout it out. Makes you lazy. What else? Munchies. What else? What was that? Holistic health. Helps you sleep. All right. Oh, you in the back? Social media? Hold it. Oh, it's not working. Okay. Can you hear me? Okay. All right. So thank you for all of that. We're going to start, and what we do is we say thanks for all your input, and then hopefully by the end of this presentation we'll be a little bit more informed on what the current research is on marijuana, its benefits and whatnot. Okay, what is the most commonly used illicit drug in the United States? Anybody? C. Yes, we throw in the red herring of tobacco because tobacco is not an illicit drug, and so most students are saying, what do you mean? Tobacco is really common, but in 2007, there were 14 million users of marijuana, and in 2011, that grew to 18 million users, so it's a steadily increasing amount. And we throw out there that regardless of state law, it's illegal to use or possess marijuana unless you're over 21, and it's also illegal to drive under the influence of marijuana.
What is the active ingredient in marijuana called? That's correct. So tetrahydrocannabinol, or THC, it affects the brain because it acts on the endocannabinoid system in the brain. It acts as an agonist of an endogenous brain lipid. And so it activates the reward system in the brain by stimulating the release of the chemical dopamine, which is why many people report those feelings of euphoria and relaxation. Other people report certain hallucinogenic properties like heightened sensory perception, brighter colors, that kind of thing, but also sometimes associated with marijuana use can be panic and paranoia as well.
Name an organ besides the lungs affected by marijuana use. D, yes, correct. So it affects the brain because it acts as a cannabinoid receptor agonist, so it affects the way you process information. It affects the heart because it increases your blood pressure, it increases your heart rate, and it also actually affects the reproductive system because it adversely affects sperm production, and for women it may affect your menstrual cycle. So.
Which of the following conditions does not benefit medicinally from marijuana use? That's correct. So marijuana has been used, has been shown to have medical properties as well, especially for treating nausea, insomnia, particularly in cancer patients. Unfortunately, the US government still does not believe that marijuana has any accepted medical use. But we like to remind students that although marijuana can be prescribed for these medical conditions, that doesn't make it okay for them to abuse it recreationally, just as you would see with prescription drugs.
What amount of time is needed to pass before you are able to drive after cannabis use? I'll give you some time to read this. Oh, you can't see it. Oh, do you want me to read the options for you? Okay. A, it is illegal to drive when there's any detectable THC in the blood. B, there is no specific time since it depends on the individual, the type of marijuana, and the method of ingestion. More research is needed to answer this question. C, when you do not feel high anymore, on average about 3 hours after smoking. D, it is up to the individual's judgment. B, yes, correct. So depending on the state laws vary from 0 tolerance to 5 nanograms per mil of THC in the blood. And it's different from alcohol breathalyzer tests because since marijuana can stay in your system for up to several weeks after you use it. There's no test that measures current impairment. So it can range anywhere between the 3 hours mentioned in C to up to 12 hours. And also it affects the cerebellum when you smoke marijuana, which impairs your motor control. So that's another factor to consider when you're driving under marijuana.
Which form of intake has the least predictable time of onset? A, using a vaporizer, B, smoking a joint, C, consuming marijuana edibles, and D, they are all approximately the same. That is correct. So consuming marijuana edibles has the least predictable time of onset. When you smoke or use a vaporizer, that's immediately absorbed. But when using marijuana edibles, it has to go through the digestive system and be processed by the liver. So not only is the onset late, but it also the effects last longer than with smoking.
This percentage of UCSD students smoked weed in the last month. So specific to our school, but you can venture a guess. A is 4%, B is 18%, C is 32%, and D is 54%. C and D, I heard? It's actually B, 18%. So the reason why we show these percentages is because we want to kind of dispel the assumption that a lot of people on campus smoke weed so that students don't feel pressured like everybody smokes weed or a high percentage of students smoke weed. So we wanted to throw out this statistic and just let everybody know that it's a little bit lower than what people think. Oh, it's okay. Which is not a common immediate physiological consequence of smoking marijuana? A, lowering of inhibitions, B, bloodshot eyes, C, difficulty speaking and listening, or D, increased heart rate. Anybody shout it out? A, yes, correct. So A, lowering of inhibitions is more commonly associated with alcohol, not marijuana.
What are some behavioral issues that might arise from marijuana use? A, schizophrenia, B, anxiety, C, bipolar disorder, D, depression, or E, all of the above? That's right, all of the above. So marijuana has been shown to produce some manic symptoms that can be associated with bipolar disorder as well as schizophrenia. Particularly with schizophrenia, there's been a lot of research showing that especially individuals who are already at risk for the disease, whether genetically or because of other factors, by being a frequent marijuana user, there's a twofold increase of developing schizophrenia. Also, schizophrenia is a disorder that usually onset is right around the time of adolescence. So it's during that time of critical brain development, the frequent use of marijuana really does increase that risk.
According to the Drug Enforcement Agency, addicting drugs can be classified into 5 groups called schedules. Which schedule does marijuana currently fall under? Schedule 1 are when substances have no current accepted medical use in the U.S. and have very high potential for abuse. Schedule 2 are substances that have high potential for abuse, which may lead to severe psychological or physical dependence. 3 are substances that have moderate potential for abuse, and 4 are substances that have low potential for abuse. What do you think? E? Why did I hear E? D? What do you think? Shout it out. A? Yes, correct. So right now, although there are some medical benefits to marijuana, the federal government doesn't recognize that because there's a lot of research going on in terms of marijuana use. And so we like to inform students that because we're a federally funded institution that we do follow this. And so under no circumstance can you have any use of marijuana on campus or possess any marijuana.
Which of the following is used to test current marijuana use and can produce a positive result up to 7 days after marijuana use? A, hair test, B, urine sample, C, blood test, and D, saliva sample. The answer is actually C, a blood test. So blood test and saliva tests are used to test for current marijuana use. A saliva test would come back positive up to only about 24 hours after using, whereas a blood test can bring up a positive result up to 7 days later, especially if you are a heavy user. And then in contrast to that, a hair test or a urine sample can be used to test if someone has ever used marijuana. They're unlikely to produce a positive result if you just tried it once or twice, but people that were heavy users for a certain period of their life will probably produce a positive result. And so this is something that we really like to stress to our students. Nowadays, employers can require a drug test, and that's definitely something to think about.
Smoking marijuana and drinking alcohol can result in all of the following except A, nausea, B, increased concentration, C, panic, anxiety, or paranoia, or D, an increase in psychotic symptoms. Yes, so one thing we like to mention is that when you mix alcohol and marijuana, the results can be really unpredictable because they kind of contradict each other. Marijuana may stimulate you, it may calm you down. It's a little bit unpredictable, especially with alcohol. And also, marijuana has been shown to inhibit your vomiting reflex, and so if you drink a lot and you smoke a lot at the same time, you are less likely to vomit, which may lead to alcohol poisoning. And then what we like to do, because we are split up into teams and we tally up each of the team's scores, at the end, we allow them to kind of wager the amount of points that they want to for the last tiebreaker question. And Blanca's gonna go over that.
So our final question is, the American Psychiatric Association recently added this substance-related disorder to its manual. Any guesses as to what the answer is? So the answer is cannabis withdrawal. And so some of the symptoms and diagnostic criteria that have been listed in the new DSM-5 include irritability, anger, aggression, nervousness, anxiety, sleep difficulty, decreased appetite, weight loss, restlessness, and depressed mood. And we really like to tell students about this because I think there's a lot of stigma going around about how marijuana is not addictive as opposed to a lot of other drugs, but it really can be, and it has been added to the newest DSM-5.
And then that's it. What we do is we open it up for questions, we give out an evaluation, and we just kind of leave it up for discussion after this point. So thank you.
Good morning. My name is Mufaro Zakers, and I'm the Marijuana and Other Drugs Team Lead for Peer Health Education at San Jose State.
I'm Cashmere Hamilton. I'm part of the specialty of marijuana and other drugs.
So what we're going to do is we're going to give a brief overview of what we went through in terms of creating a marijuana curriculum, and then we're going to present an activity that we like to call the Circle of Influence. And this is one of the activities that we actually present in our classrooms. So when we created this marijuana curriculum, we wanted to, one of the things we struggled with was how do we talk about this subject without the audience becoming defensive? So we felt that the more interactive we create this presentation, the least likely we'll have like some type of like battle or war between presenter and audience. So before every presentation, we go over agreements. Now these agreements, we talk about, we want to have respect for one another. We want to stress confidentiality, so whatever is shared in the classroom will stay in the classroom. But most importantly, we say that we are here not to condone the use of marijuana, nor condemn the use of marijuana. We are here to educate ourselves and others on the facts and effects of marijuana. So with that being said, with the Circle of Influence, Cashmere is going to go over that in detail, and after we go over some of the brief interview of what we went through, it goes into the factors of influence our attitude towards marijuana. So what are the positive factors and what are the negative factors? So at San Jose State, there's a lot of people who use marijuana for different reasons. There's medicinal use, there's peer pressure, there's media, and things like that. And that's what things that we explore, and we get the students talking and things like that. So if you all look at your tables, you all have worksheets. Now, not everyone is going to be able to have their own individual worksheet, but this is it's a group activity. And so we're going to go ahead and we're going to put it on the big screen, and we'll have Cash Monet discuss how we go over the Circle of Influence worksheet.
Great. Hi, everyone. So how we work this activity, we introduce it as Circle of Influence, and then we talk about how it is a self-reflective piece and how this is an individual activity, and we want to be able to use this as an opportunity to kind of discover why we either use or not use marijuana. We want to be able to let people know that regardless to whether we choose or not choose, there are different factors that affect that. So we use the social ecological model, and we go through different areas in order to determine those things on our own. So first I go over and let people know each area and then give them a little bit of an example on both either spectrums on how that works. So the first one is the individual. It's more of our own personal feelings of why we either choose or not to use marijuana. And so an example of that could be that a person may feel that marijuana, it smells good or it feels good when we're on the substance, so we might want to use that in order to get either euphoria or any type of other feeling that makes us feel happy. So another thing as well as we may choose not to use it because we hate the smell or we don't like the way it feels, or we just don't want to do it because of other factors. But the next one would be the interpersonal, and that has to do more with the social interactions we have with other people. So our friends, our family, our social circles, those do affect our thinking patterns. So for example, it might be that our friends and family do use marijuana, so we might want to do that because we want to be able to interact with them and be able to be on the same level during certain social settings. Another example might be that we might choose to not use it because we have friends and family who may either not want to be around us if we were using it, or they might look down upon us if we choose to use it, so we want to be able to show them that we want to be a part of their lives, so not using it. The next one would be the organizational / community that has to do more with the surroundings, community that we live in. So if we live in a community where using marijuana is frowned upon, we might choose not to use it. Where if we live in a community where a majority of the people that we know use it, we might be more interested in trying it out, giving it a shot, and being able to interact with them in that way. And then the public policies has to do with more of the laws and regulations that we are set in place that will either encourage us or not encourage us to use. So, for example, on San Jose State, we're not, there's policy and regulations that that don't allow us to be able to use marijuana. So we might want to refrain from doing that in order to prevent ourselves from any kind of consequence. But there are laws and regulations, for example, Colorado, that allows the use of marijuana, so we might want to use it just because we're able to without so much of a consequence. So usually I ask if there's any clarification that's needed for any of these areas so they can get a better understanding. Maybe they want to learn a little bit more about some of these areas, and then usually give 5 minutes. So I'm going to have you all go ahead and fill out your forms, and I'll give you 5 minutes to do so, and then afterwards we'll go over it a little bit in our groups.
So I guess after you tie up why we did this activity, I guess I'll go over some of the other things that we touched upon, and then we'll give it to Patty. Yeah. See, I told you, all right? It's all good. Welcome to the club. To learn, fake it till you make it. I'm a very good actor. That's why people don't know. Yeah, a couple more minutes.
You said 2 more minutes?
Yeah.
I think most people are still not sure if they're writing down or discussing.
Okay. Well, all right. So you have more minutes then? Or you have longer?
Okay, everyone, we're going to do 1 more minute.
East Bay? Really? I referee soccer there, and we had our fun run over that school. You guys have a really nice campus. Yeah. You all, yeah? What high school did you go to? Fremont? Okay. I'm from Tracy. I went to West High, Cowtown. Yeah.
I went to Modesto High.
35.
We already have a variety of specialties, so kind of dispersed. So we have body image, violence prevention, nutrition, healthy lifestyles, sexual wellness, marijuana, drugs, alcohol. And then you have to pick at least 2 specialties.
You ready?
Okay, I hear a lot of great chatter, but we're going to go ahead and stop writing and
Let's wait till it's quiet and start talking. Isn't it like clockwork? All right, go ahead.
okay, thank you, everyone. So what we're going to do now is we're going to, in our tables, just go over what we have written down. If you feel uncomfortable about anything that you've written on your sheet, you don't have to discuss it, but we'd like to have as much of a friendly, open conversation as possible. So we'll give you another 5 minutes to do that.
Sorry about that. Okay, we're going to quickly wrap it up just because with time, we're going to go back to the circle of influence. Sorry about that. So can we just have one table just quickly share what they shared for one of the circle of influence papers? Do we have a table that want to volunteer what they shared? Any brave people? All right, the first table. Awesome. What did you all share for individual factors? No, that's fine. Yeah, so again, that's an example of a negative factor, whereas you don't like the smell of it, so that's an example of a negative factor. And the reason we went over this activity is so that we can be aware of the factors that influence our attitude towards marijuana, so that we can be more conscious of these factors and we can make better conscious decisions whether we choose to use or not to use marijuana. So with this time, unfortunately, we're not able to go through the rest of our presentation. We're going to transition over to Dr. James Lange from San Diego State University.
Well, thank you. So this is a little unusual for this conference, but what we decided to do is have a discussant in here, and that's going to be me. And so I'm going to make a few comments and try to frame this, and then there will be time at the end for questions, and you can ask the groups anything you want for that. But so one of the things I wanted to mention, or some commonalities that I'm seeing in these, is both of these are recognize the idea of resistance and a need to develop a program that addressed it. And I think that's an important concept that we have to have in mind as we start to develop these marijuana programs in this changing environment. It's a highly political issue right now. It's very easy to fall into a trap of debating, and I'll go over some of the research on why that can be a critical mistake in any of our prevention programming. And so what I think we're seeing is that programs starting to develop this awareness that they have to address marijuana in a different way because it is getting treated differently and will continue to get treated differently over the next several years. So one of the things I did want to mention is that if what you would like to do is enter the debate, that can be an interesting process, and you're welcome to do that. And there is an organization that is starting to galvanize around folks who would like to advocate for avoiding a legalization process. And their acronym is SAM, and it's Smart Approaches to Marijuana. They're becoming, I think, the recognized focal point for the argument against legalization. Of course, there's other organizations that are receiving much more funding and attention that are for legalization. If that's your passion, then you can probably find places to channel that. But I don't think that when we're dealing with individuals on campus, it's the time and place to enter into these discussions. First of all, none of us are going to be the ones who decide if it's legal or not, nor will the students. They may have an activist position one way or the other, that's fine, but what we're really talking about is their behavior and what they're going to be doing that weekend or that night or whatever, and it's not the time. And so I think we're seeing that start to come into the types of programs that we're just gotten to see. I like to put this slide above me because I honestly believe that when we're doing marijuana prevention, there is the ghost of reefer madness always over our shoulder. It's really easy for folks to expect us to be using that sort of overblown arguments to convince people not to use. And so we really have to remember that it's over our shoulders at all times, and that we have more work to do because of that, because it's naturally going to raise that sort of resistance. And also remember our population, and that is very smart, educated students, right? They are being trained on how to find weaknesses in all the arguments that you might present. And that's a good thing, but it makes it difficult if you're going to start getting into a debate. Because in fact, we're in a state of research that is very new. And there are conflicting studies on almost every topic that you just heard. And they can cite them, just like we can cite other ones. And we can have a great debate. But that is an academic process, and that's our population. We are in a changing time, and I think it is analogous to the changes that were occurring back in the 20s with the end of Prohibition. I have this fun little news clip here. Only 9 states get beer as medicine. That happened in 1921. And then, not too long later, Prohibition is doomed. We are seeing that. It started with medical marijuana. It is moving state by state, and that's how it happened with Prohibition as well. It ended federally after it ended in the states. A kind of fun quote is, the Dry Council sees hope, this was back in 1921, believes people will resent turning drugstores into booze shops. Go into a drugstore, all right? Prophetic messages here. All right, we're not visionaries. We could be very wrong in how this is going to play out, but there is history here, and I don't want to be on the losing side and spend a whole lot of time trying to argue against something that I think is clearly happening. I don't know if this will work. Yeah, this is just. Is it possible to just click the picture? And I don't know if we're set up for sound. Do you know if we are? That's all right. Never mind. But anyway, you go to Ken Burns' documentary on Prohibition, and there's some very prophetic quotes about the need to not be rigid and the mistakes the Dry movement made in addressing what was the collapse of the Prohibition movement. And we're seeing change in marijuana, the news. Anyway, we'll move on. But I think the important point here is that this is such a moving target that our programs need to be adaptable and need to be focused on what the students are actually doing and not getting into this argument. And here's some really cool data that was just presented at NASPA by Diane Logan, Jason Kilmer, and Timothy Marshall. And I'm just going to summarize, because this graph, and I know it's difficult to see for those of you far back, but basically what you're seeing is one line going up and one going down. And these were mandated students who got in trouble for alcohol. This is an alcohol study. And it turns out that just getting caught, just going through the system, you get a natural reduction in use as the result of that. But then, as is typical, a campus did different types of interventions on those who were mandated. One was the basics type motivational interviewing approach. The other was the police Saturday school, literally using McGruff imagery, okay? And the green line is the BACs over 6 months for those who did the Saturday school with the police. And the purple line is those who did it with the motivational interviewing approach. Recognizing that those who are in resistance or those who are looking for an external cause for the problems that they're facing, if you go at them with arguments, you are going to get them to rehearse all the reasons you're wrong. And you will actually do harm to what your efforts are trying to achieve. So we need to focus on the motivations and motivational approaches. We need to focus on making sure that we don't encourage resistance and defensiveness and all those things. And so what we're seeing is programs starting to do that are taking a more neutral tone, looking at the reasons why people are choosing to use and the reasons people are choosing not to use. What Jason Kilmer will talk about when he's talking about this is what are the good things that marijuana gives you? And he'll have people generate those. And then he says, okay, so what are some of the not so good things? And the language is important. It's the not so good. He doesn't say problems, doesn't say negative consequences, doesn't say harms. It's the not so good things. When he does that, he gets people generating dozens individually and collectively over 100 different not so good things about using marijuana that they themselves recognize and can generate. He doesn't cause the argument. They do it internally, and it causes change. So I wanted to just mention that we got to think about what are the harms we're actually trying to solve. Are all our interventions designed to just get people who are using at this level down to another lower level? Or are there specific things that we're trying to change? Is it impaired driving? In which case, yeah, maybe some education is needed, because we know that from one study that only 11% of the drivers on a weekend night who were pulled over who had used marijuana thought it harmed their driving. 11%. Okay? There were more who thought it actually improved their driving. There's an education point right there, okay? But how you approach it might affect how convincing you are. Okay? And then I just love this quote. It's from Rosencrantz and Guildenstern are dead. It says, audiences know what to expect, and that is all they are prepared to believe in. I have been told over and over again when I do a presentation that I am on one side or the other. I kind of treat it as a Rorschach test, because I do my best not to, and I get told that I'm biased, but the bias seems to depend on the person more than me, because I get it from both sides. So that's sort of good, but it also shows that people are looking for that. If you've done presentations, ask yourself, how many times did someone ask you, have you ever used? You know, that's a great point for them to demonstrate that they're ready to argue. Thank you for raising that issue, but I'm not going to bite. And I'm also going to think about, why are they looking for that? Why are they trying to judge us so much when we're giving these presentations? And what is that going to do to our ability to actually make change if they are experiencing harms associated with their use? So remembering how to roll with resistance, not getting into the cul-de-sacs where people are trying to lead you. Going through all these processes in our presentations, I think will benefit us all. So that was just some points that I wanted to raise. I think these were great demonstrations of the changes that we're starting to see in programming, and I'm really hopeful. Now, one of the things that I'm going to throw one more little factoid at you. We did a survey of the colleges across the state a couple years ago, and marijuana was the #1 mentioned problem that's increasing on campuses. Okay? So when we asked them, what are the things that you're seeing on your campus? Marijuana was #1 as the thing that's going up. And yet, here we have represented the folks who came with programs for this conference. So I'm going to give a challenge both to everyone. We need to be developing programs that are taking into account this new environment we're in, looking for ways of changing the harms that are associated with marijuana, recognizing what our goals are, and using what we know can work from other venues to work within marijuana. And I challenge you for our next year's conference to have that program and that can demonstrate effectiveness on something related to marijuana use, so that we can start expanding it as a track within this conference and keep us moving forward on this. And so I do applaud both of them for coming and sharing their wares on this. It's a lot easier for me to talk about it than to actually create the programs, and they're doing a great job. So I want to congratulate them and also open up for questions. I'll go ahead and moderate the questions, but I'm assuming most of the questions will be for the panel. So if you want to go ahead and tell who you're asking when you ask the question, that would be great. I think their mics work too.
Yeah, sure. So what we do is first we go over agreements, and then we go over marijuana basics. So that goes over what the main chemical ingredient that we touch on, which is like the lady said from UC San Diego, delta-9 tetrahydrocannabinol, and we focus on that because again, marijuana is made up of different chemicals, but delta-9 tetrahydrocannabinol is the carcinogen, which is the cancer-causing agents. And we go over the effects of marijuana, and we have an activity where we talk about the physiological, psychological, and the physical effects of marijuana, and we have them match those categories with certain effects of marijuana, and we go over common policies and laws dealing with San Jose State University. We go over statistics, meaning percentages of employers that do have drug tests, because again, we go to college to get a job. So students need to know how many employers are out there that are doing drug tests. And then we go over the combination of marijuana and alcohol, like what are the effects of that? Because when we think about it, marijuana and alcohol, those can have two different effects. So that's as if the body is receiving two different signals. So that's why the body can start to feel nauseous, things like that. And then we touch on the circle, and then we transition to the circle of influence that Cash Bonet went over. And then we go over, we clear up common myths and facts. For example, does water help you pass a drug test? Obviously it doesn't, because with tetrahydrocannabinol, it goes into the bloodstream. And then we finish off with resources, things like that. Good question.
For us, we found that UCSD students were more receptive to science-based responses and having science backing up our reasoning. And so they're really excited. I think when we had it split up into teams, everyone was, shouting what they thought. It was really more group-oriented. Everyone got really involved. And so they were really interested to see the facts behind marijuana use rather than trying to sway them one way or another. So they liked seeing more like hard facts behind it.
So for ours, we focused on making sure we use the language and the influence to create a safe space for everyone. So as we said, we state that we don't condone nor condemn the use of marijuana, so that way people will understand we're not here to judge whether they have or have not used now or previously. So we can be able to have a safe discussion. And pretty much we developed it ahead of time, and we made sure we used all of this language before we went out and piloted it out to the group, so that way we can know for certain that where we were comfortable for being able to present this. And mostly we got really good feedback from the students. They're very receptive, they asked questions, and they were interested in learning more. So I feel like we really got a lot from it.
For us, we haven't. It was more of just throwing out the information that we have found on the subject, and then what we do is we pass out evaluation forms to have them share what they gained from the presentation or what they would like to see more of. And also, students, they actually ask us what our sources are, and they really like to look into that and see where we got our information. And so we happily provide that for them, but no, we haven't asked them what their personal use is on it.
That's a good question. So you asked, do students are referred to our program, or do we have to go out and outreach? So for our school, we actually talk to professors, we talk to Greek life, we talk to athletes, and then we will go into the classrooms or whatever building they have reserved, and we'll go in and do those presentations.
At our school, the way actually almost all of our programs work is we get requests, and those come from all over campus, so anywhere from Greek Life, other organizations. A lot of RAs have us come and talk to their freshmen or even some of the second years living on campus. I mean, I've never been asked that at a presentation specifically. I think one of the goals with our icebreaker was to kind of open it up and just ask, what do you know about marijuana, anything, whether it's a song or something like that. And it kind of opens up. People laugh, you know, we all hear things about marijuana, and it just sort of makes it a little bit more okay to talk about.
So I've learned that when I put myself into the presentation, we get better feedback. So I've told my experiences about marijuana, and again, that's what Cashman was saying. We try to create an environment where again gets the audience comfortable, and I tell about my stories, the effects of marijuana. We're all made up chemically different, and so I tell my stories how I used to feel paranoid. I used to think there was a police helicopter outside looking for me, so I would never go outside. So again, when we create that environment where they're comfortable talking to us, they're able to ask questions that they don't know about, because marijuana is still taboo, whereas if we take this approach where we've never used marijuana, they're going to be more defensive, they're going to be quiet, and they're not going to want to talk to us. So good question. Yep.
Okay, so and I get asked that sometimes. So what are the things that I can use to persuade someone not to use? And what I would suggest is that we're not in the business of trying to persuade them with facts. What we want to do is explore their use from their perspective. So this is where using some of the language that Jason is, Dr. Kilmer's suggesting, I think is really useful. So for them, what are some of the good things that they're experiencing using, and what are some of the not so good things? They'll generate the things that are most meaningful to them for why they may want it. So they may say something to the effect of that that gives them headaches the next day, or it gives sleep problems, or whatever it is, and say, well, yeah, marijuana has been shown to affect that. So what are some of the things you could do to avoid having those sleep problems that you're having from marijuana? And you can start working on the problems that they're experiencing, because it is very difficult to tell someone who's using that they're experiencing a problem, right? Because they may not be, or they may not see it. So I would encourage you not to try to find that magic thing, but have them generate it. Did anyone want to actually offer something, though?
I've just found that a lot of the students were surprised that it affected their reproductive health also, especially the guys. So I think it's an interesting fact, and it's worth mentioning.
Thank you for attending this session. I just want to thank the panel members, and I have a certificate for presenting at this. And so if you would like to give another warm welcome applause to our panel members. Oh, yeah. Lily? I have like wrong names because it's incorrect. I have the wrong names. It's okay. Okay. This is from.